Welcome back. Joining us this afternoon is Dr. Robin Rutherford with the Art of Dentistry, and we appreciate you being with us today, Dr. Rutherford. Always giving us good tips.
Yeah, always enjoy being here.
Well, today is one of those topics that you never know when it's going to happen to you. When your tooth gets knocked out, and say you're not in a place to maybe run to the dentist right then and there, what should we do?
Okay, well, here's the scenario, and you can imagine this. Okay, your son is at a football game, you know, he's playing. That's the first thing you would think of, but what really happens that I see the most is skateboards and bicycles.
Right.
You know, you're in the house and your daughter, your son comes running in and their hand is bloody and whatever, and they've knocked out a tooth.
Right.
So the key thing about this is that time is of the essence. If it's during business hours, I would say go to the dentist.
Right.
Any dentist,
right,
you know, would know what to do. But also the fact that it's so important to get there in like less than an hour. You know, if it's not during business hours, go to the emergency room.
Okay.
Because they should know what to do. But actually, you know, here's some other ideas. What should you do to get the tooth there? First of all, go out and get the tooth. I have actually had people come to me with that happen, and they go, oh, we forgot the tooth.
Right, because they were concerned with the blood, well,
yeah.
and the blood and everything else. They just...
The idea is to put the tooth back in, you know, and I have to have the tooth. So when you get the tooth, do not actually scrub it clean. Now you would think, oh, get all the dirt off, well, maybe swish it in some water or something, but do not scrub it clean, because the little cells, the little tissue that may still be on the root is actually part of what will help it to heal back in correctly.
Okay.
And to transport it there, should you wrap it up in a Kleenex or something dry? No, the actual best thing is to keep it moist. Because again, we want that little soft tissue that's on the root to live, for those cells to survive. So the number one thing that has been recommended for 1,000,000 years is milk. Put it in a little bit of glass of milk, or contact lens solution, which I had never heard before, and I just recently read that, and that's a good idea.
That is a good idea.
But time is of the essence, and actually, you know, instead of bringing it to me or to the dentist to put back in, it makes a difference for healing if it's under 20 minutes. Now, you're not going to get anywhere in under 20 minutes from the moment that it happened. So here's the number one thing really you need to do. Put it back in. That's what I'm going to do.
Okay.
Put it back in. It's always going to be an upper front tooth. You can see how it goes. You're not going to put it in backwards or some way that's not right. It's only going to go in one way, and it's going to go in what looks like frontwards, you know. Okay. Just put it back in, and then have the kid or you or somebody hold it in until you get to the dentist.
All right.
And I'm going to put it in if you don't, but that 20 minutes is already gone.
Right.
And then I'm going to stabilize it so it'll stay in. So that's the main thing to remember. Put it back in.
Right. That is a wonderful tip. We appreciate you sharing that with us today. Thank you so much. If you have any more questions, of course, you can always find Dr. Rutherford on the web. You can go to gentledentaldoc.com, or you can call his office for more questions. Thank you very much, and we'll see you next time.
Okay,
all
thanks.
right. When we return, Chief Meteorologist Greg Morgan will have a look at your Monday and your work week forecast. Stay with us.